Hello, good afternoon. It's Dr. Trudy Ufondo of Snowspirations Global Health Solutions. And I just want to quickly give us an update on the state of COVID and COVID vaccines globally. And this particular broadcast is just for public service announcement and also for public health purposes. And this is what we know as of today. COVID-19 viral pandemic, it's real. Number one, COVID-19 viral pandemic, it's still ongoing. It's still killing people. There are still so many people that are contracting this. And the burden of COVID-19 globally, it's not yet over. Now, this is what we know. Over time, after the 2020 debacle, which so many people died, so many. And we were so confused. We didn't really know the exact situation of things. And so many doctors, so many researchers went into work. And luckily, they were able to develop some vaccines, which actually helped in mitigating the death toll. Now, this is what we know for sure. Over time, they've developed so many vaccines, and it's worked. It's actually helped to mitigate the severity of the COVID-19 virus. Now, this is what you also know. The fact you get this vaccine doesn't necessarily mean you're not going to pick the COVID virus. You might pick it up. But if you eventually pick it up, despite the vaccines, the severity is going to be milder. You might likely be able to survive, to avoid going to the hospital, to avoid the complications out there. Now, there are so many types of vaccines out there, and it works. Now, it's possible that your location currently might not have the vaccines available, or they might have so many policies, or they might have so many things that might not be of global standard. I'll give you an example. Currently, the vaccine is globally approved from every angles of the world for everybody. There are only fewer exceptions. So the vaccine is safe for adults, for a couple of people within a particular age gap. Currently, they are developing vaccines for kids. Now, women that want to become pregnant are also recommended to take the vaccine. Pregnant women are also recommended to take the vaccine. It's completely safe right now. We don't have any evidence to say otherwise. Now, the gains of having your COVID-19 vaccine far outweighs all the rumors, all the propaganda, all the researches out there. Now, I will tell you what I normally do in life. When I don't understand, I seek knowledge. When I get knowledge, I keep seeking knowledge. I know there are so many things we haven't really been able to explain about the virus, so many things. But this is what I know. Without the advent of the vaccine today, we will not be where we are today, especially in America. I'm sure you read so many news. I'm sure you watched so many hurtful videos of so many people that died. The advent of the vaccine actually helped a lot. So please, if you have been able to take the recommended shot, so depending on the vaccine you're taking, you can take like 2 or 1. If you're taking Johnson & Johnson, it's just 1. If you're taking Pfizer and the other one, you're supposed to take 2 different vaccines depending on the duration recommended. Now, the current development in the vaccine world is the approval of the booster dose. So in some locations, Pfizer especially approved and recommended booster dose. Now, the essence of a booster dose when you're talking about vaccine is to build up your immunity. You see, over time when you take vaccine, the role of the vaccine is to prevent you from picking up an infection or to reduce the severity. So over time, depending on your classification, depending on your situation, you might have reduction in your protection. You might have reduction in the immunity. So there are specific population that got recommended to go for the booster dose. Now, the criteria for the booster dose means you've taken the previous 2 recommended shots. Now, if you've done that and you're 65 years and above, and you're above 18 and you have some risk factors or you have pre-existing medical issues, it's still recommended you take the booster dose. When you take the booster dose, what's going to happen? you're gonna activate your immune system to protect you more. So taking the booster dose is more like someone that has an insurance. So if your insurance is about to expire, what do? You buy more insurance. My people, the reason why I'm making this video is just to tell you what's going on. You see, it's very easy to do nothing and expect something. But when you do something, whatever you expect will be in tandem with your efforts. I understand you have so many questions. I understand there are so many theories. There are so many people that believe it's this, it's that. But guess what? You want to live to tell the story. You want to survive 2021 so you can tell the story in 2022. So please, if COVID vaccine is available in your location, please go take it. If you've already taken the 2 recommended doses previously and you're qualified for the booster dose, please go and take the booster dose. Now, while you're doing all this, we have seen things that work. As a public health practitioner, we know that the facial mask works, okay? So the reason why I'm wearing this is to prove that facial mask is actually working. So wear your facial mask religiously, appropriately. Once you go out there to interact with people, wear your facial mask. Now, it's very difficult to enforce social distance lately because people are gathering and doing their stuff. So the best way to protect yourself as I'm talking to you right now is to constantly wear your facial mask. Still continue to wash your hands. Now go and get your vaccines. These are the things we know that work. Hopefully, they are developing some drugs. We have some flickers of hope. There's a particular drug that is in the making now. So hopefully we're gonna defeat this. Hopefully we're gonna breathe again. Hopefully we're gonna get back our world to what our world used to be. COVID-19 has damaged the very fabric of our world. I can't wait to feel free again. I can't wait to travel freely and meet the people I want to meet. Let's all be wise. Let's do the right things, especially if you have elderly people or people with pre-existing condition or people that might be at risk. Encourage them to get the vaccines. It protects, it works. Keep wearing your facial mask. And I'm especially talking to my people in Nigeria. I know we believe so much in God. We ask God for a lot of things. God actually works through people, especially people that God gave special knowledge for development of newer trends, newer vaccines. Thank you so much. And remember, in Snowspirations, what we go after is quality. We use quality knowledge to defeat poor attitude. And if we can defeat poor attitude, if we can imbibe good attitude, you can practice better. When you practice better, you get a better outcome. So thank you so much, and I'll see you some other time. Until I see you, God bless you and bye-bye.